Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about, can you get a medical coding job without a certification? If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, the question of the hour, or of the next 20 to 25 minutes. Can you get a medical coding job without a certification? Say you have completed a medical coding program and you say, well, Blue, can I go out and look for a job right now? The answer is yes. Yes, you can. There are plenty of people who say that they went out and they started applying as soon as they completed their program, and they put that on their resume that they completed a program, and some employers were saying, okay, fine, we'll give you a year. Some say 6 months, some say 2 years. I saw one lady that said that. She said that she completed her program and they're giving her 2 years to get her certification. So yes, it is possible to get a job in medical coding without a certification. Now here's the thing. Just because you can doesn't mean that you will make what a certified medical coder makes. Some instances, yes. Some instances, no. A lot more instances of no. You're not going to make what a certified medical coder will make, because the employer knows that they don't have to pay you as much as the standard market for a medical coder would be. So that is something to think about before you start applying out there, if that is really what you're after. Now, we don't go into money specifics on my channel, but I'm letting you guys know that that is a possibility, okay, that you may run into that. Now, here's the other thing. Some programs will give you a certificate of completion once you have completed your medical coding program. Others will not. When I was in the trade school, I did not get a certificate of completion. I didn't really need it because I was completing the program and then I was going to sit for my certification right afterwards. Employers are not really looking for, oh, you have to have a certificate from this particular school or that particular school. What employers are really looking for is for you to be certified. Certified, and that you have the knowledge and that you have the skill to be able to do the work. And so that is what they're really looking for. So if you've been fully and completely trained, but you either don't have the money yet to take the certification exam, or you feel like you need a little bit more time before you sit for that certification, but you want to go ahead and get started, you can always start applying. It is possible, guys. There's a lot of things that are possible in this field. It is possible to not have to spend a ton of money to go through school. You can train yourself to learn medical coding. It just takes some discipline. It takes some discipline and it takes a little bit of research, and that's all. But there's a lot of people that, they're not really good with that self-discipline, and you have to be honest with yourself if you are good with it or not. And even if you're not, it doesn't mean that you can't make yourself be better at it. These challenges that we face, whether it is that we read slow, or that we have a hard time understanding, or that we have a hard time with our communication skills, or maybe our speech isn't as clear. These are all things that can be improved, right? And these are all things that can be worked on. But you have to have that dedication and want and drive to be able to do that. So that's the thing that I would say. You have to be able to prepare yourself in ways that you're going to have to anticipate different issues that come up, right? So if it is that you are terrible with writing, you may want to start writing, so that way you can learn how to write properly. There's a ton of videos on YouTube about writing properly. And when I say writing, like, eventually you're going to have to start querying providers. Some facilities will use a template, and a lot of them do. So that's okay, but you still have to be able to formulate the message. And sometimes you'll have to send out a coding tip or something, or maybe pass along some information. And so it is a good idea to be able to have, just the ability to write a well-crafted email in speaking, where people can clearly understand what you're trying to say or ask for. And it doesn't require a ton of experience to be able to do this. Once you start in the medical coding field, you're going to be, there's not this is a beginner, this is a intermediate, and this is an advanced. You're going to kind of get dropped in anyway. And so a lot of times people will find themselves doing things that they weren't anticipating in the very beginning. Like oh, they're there for a few months and they're already helping their coworkers out because they're really good at medical coding already, and they want to pass on some of their knowledge to some of the veteran coders. So there's always those things, and you have to be able to say, okay, I'm ready for this. And even if you're not, it's sink or swim time, basically. So yes, if you are wanting to just go ahead and not take the certification just yet and go ahead and start applying, go ahead and do that. But just keep in mind that employers are looking for their coders to be certified. Sometimes they will hire you beforehand and they will allow you to start, but they will expect you to be certified within a certain amount of time. Sometimes they don't care. It really all depends. But you have to be careful with the places that don't care if you're certified or not, because that means that they don't fully understand what coders are and what we do. There are people that, believe it or not, they don't even have a clue as to what we do. When you say you're a medical coder, they say, oh, you're a biller. No. Billers and coders are like cousins, okay? From the same family, health information, right? But billers are tending to the insurance company and to the patients and collecting the money, and they deal with the provider, of course. The coders, on the other hand, are dealing with the providers, and they're dealing with some of the ancillary staff sometimes. But for the most part, that's their communication. They pass things off to the medical biller. The medical biller is taking care of the insurance side and the patient side. But the coders are insulated in the fact that we don't have to talk to patients. We don't have to deal with patients at all. We are dealing with providers. And trust me, that is enough. They do need our attention. They do need our support because we are their teammates, whether they like it or not. So that's the thing. It's a group effort. It's a team effort. And there are some providers that will be like, oh, well, I'm the provider. I'm going to tell you what to do. That's not the case, guys. And that you have to learn to say professionally, no, we are a team and we are going to work together on this. So, that is where you're going to be at some of the time in your career. But it's all about just getting out there, being proactive and presenting yourself well. And a lot of people who don't have their certifications end up getting jobs right away because they feel like, hey, I have my skill, I'm here, I'm ready. And they're very determined. Folks like that are very determined and they get in, so it's your destiny. It is your career, basically. So as long as you are getting out there and doing your thing, good for you. But don't let that hold you back. Getting a certificate of completion, it's okay, but it's not everything. And generally employers won't even consider that as certified. Okay, they're not doing that. The only time that you are considered certified is if you are certified with the American Health Information Management Association or you're certified with the American Academy of Professional Coders. One of the two, and you only need one. I always tell new coders, you only need one certification. But some people get sucked into that vacuum of, oh no, you need this certification and that certification, and employers are going to want to hire you. Okay, here's a challenge. Since everybody likes to do challenges, like TikTok and all that other kerfuffle. Challenge. Look at the job listings for medical coders. Please, if the job ad is saying this candidate must have multiple credentials, please send me that link. Go ahead. Send me that link because you won't find any. They ask you to be certified with the American Health Information Management Association or the American Academy of Professional Coders, and that's it. So all you need is one. I have had one for the majority of my career. I had the CCA. Yes, I had the CCA for 13 years. And it wasn't until last year that I got my CCSP and I got the CCS. So now the reason that I have both is because I got the CCSP first, then I got the CCS, all right? But all you need is one, and I say that because I'm saying this to new medical coders. The CCS is the mastery certification for medical coding. This says you can code both inpatient and outpatient. Now I got the mastery getting the CCSP, and that is all outpatient coding. And so I said, okay, and I challenged myself to go that extra mile and get that CCS, and I got it on the first try. So, but that's something that If you've gone through a program, you've maybe gone to college and you've just been putting off your certification test, sometimes you know more than you think you know. So you start giving yourself more credit, and sometimes you just have to get in there and jump in with both feet and take that certification exam, okay? Don't put it off too long, because the more you put it off, even if you're going to hit the ground running and start in this new position, doesn't mean that you have to stop studying for that exam. This just means that being that you're real world in, that you're going to have a better grasp of what's actually happening. That's going to set you up for better success on your certification exam. So that is something that you can also consider, you know. But having that certification says that you have the competence to do medical coding, and it goes a long way in terms of the jobs that you can get, or just even just the opportunities that are going to be up in front of you once you get that certification, because there's more things that we can do besides medical coding. There's lots of other positions that medical coders do. So, and you'll find those out once you start getting in, and once you start getting through that initial process of finding your first job. And then, you know, you can move on to other things like CDI or auditing, or even educating, you know, which I think is fun. That's one of my most favorite things to do, is educate. I like to educate providers and medical coders as well. So, you know, but that is just me. That's what I like to do. And I have audited before because I've trained before. It's neat to be an auditor because then you can see how other people are coding, and then, you know, you can, it'll add on to your knowledge base, because then you can pass on the things that you know. Because sometimes you'll see people in the way that they code, and if it's something that could be corrected, then you can pass that on to that coder. But auditors have to be, you know, good educators. You know, they can't just be, do this because I said so. Those are the worst kinds of auditors, and there are auditors out there like that. But that's not the that's not the purview of today's episode. But you know me, I get off on my own little subjects. But that aside, if you want to get into medical coding and you're not certified yet, just go ahead and apply once you complete your program. But do sit for that certification, because you'll feel that sense of accomplishment once you get that certification. And it's nice to have those credentials after your name. And all you need is one. My new coders, all you need is one. And I recommend sticking with one certification for at least the first 2 years. At least this way you can understand what's actually happening, and you're not going to burden yourself with having to get multiple CEUs in order to keep up with those things. You're going to have the time in, so that way you know what's actually happening, and you'll have experience to back up those certifications. Just saying. So I'm going to wrap this one up. I hope you guys enjoyed this episode. If you do, hit that like button. Subscribe if you haven't already, and I will see y'all next time. Bye.